Hello. So today I'll be doing ophthalmic medications. So first I have my patient here, Miss Daisy. I have gathered my supplies. I have my medication I'm going to be using. For this purpose, we're going to be saying that I'm going to be giving Refresh Plus, which is basically just lubrication of the eyes for older patients who maybe for whatever reason they're not producing enough um, like lubricant for themselves in their eyes. So this helps them out a little bit and help them avoid dry eyes and irritation. And I also have my cotton swab. Okay, so before anything, we're going to check the MAR. We're going to check what medications to be used, the time, the route, um, verify our patient, of course, check if there's any allergies. So once we've done that, we've prepared the medication. Well, it's already pre-prepared, but we're going to assess it, verify it with the MAR, make sure that this is right time, right patient. And I'm going to come into the room. I'm going to introduce myself, knock on the door, explain the procedure to my patient. And once we've done that and everything's good to go, then what we can do. All right, so now I've verified everything. I'm in the room. I've explained everything to my patient. I am going to check the wristband. So I'm going to make sure that it's my right patient, right date of birth, right room, at least two indicators that this is my patient.
So my name is Daisy Gonzalez, and date of birth is 3/11/97.
All right, I can check that with the MAR, completeness on the MAR, and all right, I'm going to perform. I have my supplies ready. I'm going to perform hand hygiene. Once I perform hand hygiene, I'm going to go ahead and apply gloves. And then before anything, I'm going to assess the my patient's eyes externally, make sure there's no lesions, no scarring, bleeding, anything that may prevent the absorption of my medication. And whenever I give my medication, I will also assess the conjunctiva of the eye, make sure there's no redness, crusts, anything that may affect the absorption. So if you take off your glasses, please. Alright, so I'm going to go ahead and assess her eyes. I've already have my clean gloves on. I'll assess the outside. I will assess her conjunctiva. There's no crust or scarring or lesions or scratches or anything. So it's okay to go ahead and give the medications. I will also assess for signs and symptoms of visual alterations in my patient, the level of consciousness, the ability to follow instructions, and assess the patient's knowledge of the therapy and desire to self-administer the medication. If my patient is alert, oriented, and they want to be able to do it themselves, and I can teach them and have them do it back the next time I give them medications, give them a level of independence. So I'm going to make sure that my medication's at room temperature. I'm going to roll it, make sure that it's ready to go. I'm going to clean her eyes, position, get her in the right position. And when I do clean my patient's eyes, I'm going to clean inner to outer. So now that I have verified, cleaned the eyes, make sure that there's no indications to not give the medication, I'm ready to give the medication. Let's see. So I'm not actually going to give the medication. I'm just going to pretend like I give it just because I'm just not going to waste it. So I'm going to have the patient tilt her head back. And I'll pull the conjunctival site back. And I will administer a drop. One drop has been ordered for this patient per each eye. If I miss or if she blinks, I get above the eye. Anything that could cause the medication not to go actually into the eye, I can go ahead and administer another drop. And I will hold, whenever I'm administering it, I will hold my cotton below the eye. So I gave her the medication, and I would wait 5 minutes between each drop, and I will instruct the patient to close her eyes when the medication is finished. And while the patient's eyes is closed, I will apply pressure on her eye to make sure that the medication is held inside the eye and is properly absorbed. So besides the eye drops, there's other medications that we may be using for our patient, such as ointments. It's the same procedure for the ointments. You're gonna perform hand hygiene, check on the MAR, verify it's right time, right place, right route. Introduce yourself to the patient. Um, the only difference is the actual preparation, the administering the medication. So instead of a drop, what you would do is you would apply a thin stream to the lower eyelid. So I'd pull the patient's eye back, apply a thin stream, and instruct the patient to close the eyes. Once the patient's eyes are closed, if it's not contraindicated, I can help rub some of that medication in on my patient. Another thing you may help your patient do is using intraocular discs. Um, Same thing. You're going to verify the need. You're going to assess the eyes, the route, time, administration. Make sure everything is ready. Verify everything with your patient, allergies, anything you need to verify before you go into the room. And when administering this, what you're going to do is you're going to position the convex side to your fingertip. You're going to pull, you're going to go ahead and you're going to pull the lower lid and have the patient look up. Once the patient is looking up, you're going to place a disc into the conjunctival sac, and you're going to pull the patient eyelid over the disc. So they're going to close their eyes, and you're going to repeat it if the disc still can be seen. For removing the intraocular disc, you're going to perform hand hygiene as always, explain it as well. You're going to pull on the eyelid with your hand, and you're going to pinch it out. So very gently, make sure that you're not hurting your patient, and you're going to wipe any excess medication from the eye, and you can apply a clean eye patch if necessary. You're going to remove your gloves, wash hands, and dispose of the supplies as needed. And that would be removing the intraocular disc. As far as evaluation, you're going to note the response to the installation of the medication, whether it's ointment, the intraocular discs, or eye drops. You're going to record it on your MAR that you've administered it. Monitor your patient for any signs and symptoms of adverse reactions. And next time, you may have your patient do it themselves if they're feeling comfortable and they're willing to learn. They're alert enough to be able to do it. And that's what I have today for this.